If you have any serious gut issues, it might be time for a fecal transplant. Yep, that's what I said. On this video, I'm going to share with you how it works and how you get it done. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. And on this channel, I share with you how you can heal the body down to the root causes without any harmful drugs or surgery. Make sure to subscribe for more videos like this one. So let's dive in. What is a fecal implant? All right. So what it is you get a stool sample from a healthy individual that has a good, healthy gut. So what does this involve? So they are going to check this stool. It's just like like you're giving blood. They're checking it for all the diseases and everything that could cause an issue with giving blood or an organ donor. So they're checking all that type of stuff to make sure it's healthy. And that way you're not going to get some other disease from someone else. Also, the really good fecal transplant centers are making sure that the donors have really healthy guts. And what does that mean? The best ones are the people getting them have never had antibiotics or really haven't had antibiotics for several years. But the best ones have never had antibiotics in their life. They come from a vaginal birth, so they don't have C-sections, and they're eating a good, healthy diet. Many times they're not eating a lot of herbicides or pesticides. So it's going to be a really great, healthy stool sample. And they especially can't have any digestive issues. So they can't have chronic diarrhea, inflammatory bowel diseases, or constipation or anything like that, because we don't want to put in bad bacteria in there. One reason why they have these symptoms is they have bad bacteria, but they have good, healthy bacteria in there. They have great bowel movements, good, healthy GI tracts, and they are the perfect donor. So what do you do with it is you get this perfect donor sample and you put it in a blender, believe it or not, and you put a little bit of normal saline in there and you churn it up and you put it in some syringes. Many times it's done through colonoscopy. So they put you out, they put the tube all the way up to the terminal ileum, which is the very beginning of your large intestine. And then they inject all that stool sample into your colon. And then all that microbiome are left to flourish. But before they inject that is they want to make sure they destroy all your bacteria in your gut before they implant that, because they don't want any of this interference going on when you implant this good bacteria. We want you to take on this good donor's bacteria. So you take on their gut, so to speak. So you do a lot of antibiotics for 48 hours before you do this, and then you do the implant. There are some facilities that aren't doing colonoscopies. They are doing more enemas. This is not going to reach the terminal ileum. This is going to go up into the rectum, but that tends to work pretty well too. They're going through the rectum. So they have a tube. They go up through your rectum. They go all throughout all the sections of the large intestine. They get to that terminal ileum area and then they inject. So who are good candidates for a fecal transplant? So this has a ton of research for people that have Clostridium difficile. So this is a bacteria that you usually get from taking antibiotic use. Many times you get this in a hospital. It's a gnarly bug. It's a bad guy. It makes you have diarrhea all the time. You get extremely dehydrated, very difficult to treat, doesn't tend to respond well to antibiotics. And so the last resort that people go to is the fecal transplant for this. Some people might take antibiotics and they clear it. Great, good for them. But there's a ton of research on it being beneficial for Clostridium difficile to be able to give all that good bacteria in there and wipe out that Clostridium difficile, which is causing the problems. So it's really great for that. But it is great for majority of GI issues, right? People that have chronic constipation, people that have inflammatory bowel diseases like ulcerative colitis and Crohn's disease. They also have shown in the research that it's good for autoimmune diseases. Like I've talked in previous episodes, that the gut is a huge piece of autoimmune disease because that's most of where our immune system is. So if your gut's not working well and you have this huge imbalance of your gut bacteria, it can lead to autoimmune disease. So they've done research on multiple sclerosis, for example, doing fecal transplants and have seen good results with that. So why are not many people using fecal transplants, or many people don't even know about fecal transplant? It is difficult actually to get here in the United States to treat it for something besides Clostridium difficile. That tends to be pretty easy. I did a quick search for getting fecal transplants here in Utah, and you can get it pretty easy if you have C. diff. like University of Utah, Ogden Clinic, etc., all over Utah for that specific issue. But let's say you have inflammatory bowel disease. There's a lot of research on it helping with Crohn's disease and ulcerative colitis. And these are debilitating conditions, and it's hard to do. But there are clinics that are doing it. I know there are some in California, and there's others throughout the country that have the facilities to be able to do it appropriately. I know some of my patients have gone down to Mexico to be able to get it done because they couldn't really find the appropriate facility here in the United States, but you can find it here in the United States. Unfortunately, it's not that easy. It was easier. The FDA cracked down on it, like always. FDA cracks down on a lot of our awesome treatments that can work really well and made it a lot more difficult to be able to get fecal transplants here in the United States. It was much easier 5 years ago, and it's just getting more difficult now. So how does a fecal transplant work? So the idea behind it is a lot of the digestive disorders are related to too many bad bacteria, too little good bacteria, not having enough a certain amount of bacteria. And the theory is we're going to give you this good, healthy microbiota of a healthy donor that has a great digestive tract, that has a really healthy stool, and everything's working right. And we then implant their bacteria, they're good guys. They have the right balance of the bacteria. They don't have bad guys hanging out in there. So that's why we say, okay, we take the high amounts of antibiotics, we strip our body of bad bacteria and the good bacteria, whatever's in there, and we then put in this good bacteria. And then that's able to fester and grow. And then over time, that will fix the issue going on in the gut, because the big piece of what's going on is this whole imbalance of the bacteria. A big reason why our gut functions is the bacteria we have in there. So if you have bad bacteria in there, it's not going to work. And you have the good, healthy bacteria in there, it's going to work appropriately. So that's the theory behind it. So what is the process to actually get a fecal transplant? So first, you need to go to a facility that actually knows what they're doing and they can actually get the appropriate donor. So you go to the facility, they ask the appropriate questions to see if you're the right fit. So they're going to ask a detailed questionnaire. Sometimes clinics are going to do a comprehensive digestive stool analysis and see what's going on in your gut, really do a good interpretation of what's going on in your gut. And then they're going to decide, okay, you're a good candidate. Then they're going to give you high doses of antibiotics, going to clear out the bacteria in there. They're going to have already good stool samples from great donors, been tested for diseases, everything. They're really healthy. And then they're going to prepare it. Like I said, they're going to put it in the blenders. They're going to churn it up, and then they're going to implant it into the colon. And you can see how good of results you get from it. What is the average cost for this? It does vary clinic to clinic, but it's going to be like $4,000 or $5,000 to do this procedure typically. It's going to be cheaper if you go into Mexico, and it could be more expensive since I last checked, especially since COVID. Prices have increased exponentially, but it was around that range. Have I ever ordered this for any of my patients? So yeah, I have done this for some of my patients. I usually do this as a last resort. Majority of the time, I really don't have to do a fecal transplant. I'm able to treat majority of these conditions that we just discussed by other means, natural means. But when patients don't respond well with all these other treatments that we did, I do recommend that they get a fecal transplant. And I try to find a place for them. So there's some places in California, for some reason, there's quite a bit more there. And then there's facilities in Mexico that are able to do that. In my state right now, I don't know anyone doing fecal transplants, so they usually have to travel somewhere. I know there's some places in Oregon and Washington. At least there were places there. I know a few shut down because of COVID, but I do order it. I think it's a great therapy. Don't be scared that it is stool from someone else. It's great. It's a good option for those that need it. Yeah, so if you want to get a hold of me or my clinic, visit our website, integrativemedica.com. Find our phone number there, give it a call, talk to our receptionist, set up an appointment with me or some of our other great doctors. You could also just sign up an appointment directly online, and you could always see us virtually, so you don't have to come in to us in person. If you want to learn more about gut health, click my videos to the right. I'm Dr. Jake, and I'll see you there.